Welcome to the Canadian Unitarians for Social Justice meeting today. This is being recorded because we are putting it on YouTube. If you don't want to show yourself, then please turn your video off. But it is basically to promote us even more. And then today's meeting on the January 31st features the Protecting and Advancing Public Universal Healthcare by Anne Gachet Dawson. Our next meeting is February 21st on the vanishing workmen's compensation, and then on March 28th we have Charlie Angus of the Resistance Canada. We will all announce it in the Just News Express that you can see on our website, which we will show at the end of this meeting, CUSJ.org. Here it is. You can subscribe to Just News. And we always welcome suggestions for topics and speakers. There's a lot of subjects out there, but we are always welcoming any suggestions. And the co-hosts are members of our CUSJ board. And we are always welcoming more people on our board or task-oriented volunteers. And you can contact us at csjmedia@gmail.com. We are all volunteers. This is a total volunteer-driven organization. And then we have here the agenda. The chalice lighting will come as the traditional way of doing it. Then we have a land acknowledgement, social justice issues across the country. If people have anything on the go, I would like to hear about it. It might be an inspiration for others and how we perhaps can support them. Then the main address and the Q&A afterwards. We have here the traditional Unitarian chalice lighting. I'm lighting a chalice here, and imaginary, because it's a sort of a chalice in all of your homes, as it were. If ever there were a time for a candle in the darkness, this would be it. Using a spark of hope, kindle the flame of love, ignite the light of peace, and feed the flame of justice. This was by Melanie Davis. And then the land acknowledgement, we respectfully recognize and acknowledge the relationship that the First Nations, Inuit, and Métis across Canada have with the land all Canadians live on and enjoy. This acknowledgement should only be a first step in eventually approaching restoring unceded land to the indigenous nation or nations that previously had sovereignty over these lands. And right now we have to share the current activities of your social justice committees or any organizations you are with. Keep it to about 3 minutes per person to share, so that others have a chance to say something too. And this can be an inspiration for all, and perhaps how we can be of help. Okay, so is anyone wanting to share something that they're doing? I saw that Angelique had something. I didn't record it, so it might be okay. And Kate might have something. I don't know. So go ahead, Angelique.
Okay, thank you so very much, Ellen. So as I indicated earlier, I'm with the International Peace Alliance. We are headquartered in Toronto. The organization is headed by the Honorable Dr. Alvin Curling. I don't know if any of you know of him. He used to be former cabinet minister and also Canadian ambassador. He was the first Black Canadian to hold a cabinet post, provincial, and he was also the Speaker of the Legislative Assembly of Ontario. So The organization was started a few years ago, and of course, we have a international network base, and we are involved in a number of associations and development projects that we are that are in the works. But the last few years, what we have done here in Canada is essentially put together the festival in September, the opening at the Toronto City Hall every September 21st, and we have the representatives from the different nations who come and give their greetings, which means that it is the consulate representatives, the ambassadors, and the consulate generals here, the consul generals here in Toronto for the different countries. And then we have a youth panel discussion in the afternoon, and that follows afterwards. I will be putting in the chat box my email and the website addresses. You're welcome to check these out. You're welcome. Anyone here is welcome to contact me. I'll put my telephone number as well. So what we do, as I said, during the festival, we have a number of activities. We run the festival, and we have what is called the Peace Ambassadors Awards Gala and Grand Ball, which is a culminating event and closing of the festival, during which time we give the awards in different fields, including IPA, the International Peace Alliance Leadership Awards. And this year, we'll be giving the Humanitarian Leadership Award to Jean Chrétien, because for you who are not, might not know, Mr. Chrétien was involved in the initiation of the International Court of Justice, and he was behind the landmines, initiative that took place through the United Nations in terms of prohibiting and legalizing the landmines. So he did a lot of work on that level, and we're awarding him the Humanitarian Award. We have the different cultural merit awards, which are in the arts, and we have the Film Peace for Peace Awards that are for the different films in the film industry. And this year, we're extending the festival into the Ottawa and Montreal regions as well. And we plan to possibly hold the Peace Ambassadors Gala. We will see how it goes, but the idea would be whether we have it either here in Toronto, or we're going to have the Ambassadors Gala in Ottawa, because the embassies are all based in Ottawa and the government center is there, and separate the film awards and have the Film for Peace Awards Gala here in Toronto.
Oh,
So we
that
would have
sounds
two galas.
great. Yeah.
So what I want to say, and I'll be very short, I'll welcome anyone that's interested to participate, and they can join the organization. It's a volunteer-based organization, and we would love to have you involved in the festival and in the events, and of course, if you have any other recommendations, and we can we can promote also the events that you hold, such as these peace talks and social justice discussions. So thank you very much.
Okay, thank you very much, Angelique. And we will contact you so that we can put something in Just News. Kate, go ahead.
Hi, well, in Toronto, we started informally CUSJ-GTA, and we organized the Grandparents Against Genocide Vigil that takes place every Monday at 3, from 3 till about 4, depending on how cold it is right now. We haven't lasted real long in the cold, anywhere from 15 minutes to 45 minutes, but we aspire to be there for the whole hour, and everybody's invited to join us. Opposing genocide, particularly the genocide in Gaza, since that seems to be supported by our government. And we have coming up, there's going to be a one-session discussion on Alex Neve's book of his Massey lectures about universal human rights. So that's going to be coming up at Toronto First, date to be announced. And then we have a couple of books that we're going to run. We hope we'll be able to run 4 sessions on each book. One is called the Wall Between, I think is the name of it. And it has a study guideline of 4 sessions. And it focuses on the attitudes in Canada and the US between the supporters of Israel and Palestine, and how we need to come together and stop seeing each other as the other. And then the other book is called One Day Everyone Will Always Have Been Against This. And that's an Amnesty International Book Club book, which we hope to do 4 sessions discussion on. And we've got a deal with Book City to get a bunch of the books at a 20% off. So anybody who's interested can let us know at CUSJGTA, what is it? CUSJ.gta@gmail.com. You'll see our email address on the First Unitarian weekly newsletter. Thanks.
And please send me some information on CUSJ Media or just my own address, you know it. So always welcome. Then we can put something in the Just News as well. So yeah, thank you, Kate.
Thanks.
Anybody else that would like to speak and has anything to share about any action coming up? Anyway, well, now we are 17 minutes after, so that's a perfect timing to continue our presentation that we have here with introducing Anne. So in the series of Let's Connect UU Social Justice, our speaker today is Anne Legacy, and I'm murdering your name probably, I'm sorry, Dawson, talking about protecting and advancing public universal health care. Anne is the communication director of the Canadian Health Coalition, founded in 1979 to protect and advance universal public health care in Canada. Tommy Douglas was among the many people that were present at the founding of the Health Coalition Canada. Anne is a Franco-Ontarian and now living in Montreal, and has an MA in Canadian history from Carleton University and a BA from Ottawa University. She was a researcher, reporter, host, studio director, and commentator for CBC and Radio Canada, as well as Bell Media and Videotron in Ottawa, Montreal, and Toronto. And will introduce us to the Canadian Health Coalition, the provincial and territorial health coalitions, and the many defenders of universal health care in Canada. She will also discuss pharmacare, dental care, and the threat of privatization, and as well as the threat in quite a number of provinces she will talk about that are eroding the healthcare system. We see here at the photo Anne and coalition colleague Steve Staples demonstrating in Edmonton outside the Liberal Party caucus retreat on September 9, 2025. Anne, why don't you take it away?
Okay, thank you very much, Ellen. And it's a great pleasure to be among such a good group of activists and people of conscience, and I really appreciated the opening of this get-together today. I wanted to also say a big thanks to Gary Campbell, who joins us on this meeting. I've become a friend of Gary since he reached out to me and asked me to participate today, so I'm very grateful for that. Friends are hard to come by, and Gary has been that for me even in the short time I've known him. And also on this call is a friend from Vancouver, Jane McDonald Duval, who I dearly love and was very sorry to see leave Montreal. So I feel like I'm amongst friends today. So thank you very much for inviting me. So thank you for that introduction as well, Ellen. I was going to say a few words about my, not so brilliant career, but you did that for me. So I thank you for that. And I'm going to just jump in and introduce you to the coalition, which is what we're going to talk about today, the work of the Canadian Health Coalition. and the struggle to protect and advance healthcare, public universal healthcare in Canada. And you know, frequently when Canadians are polled, they're told they say that the source of the greatest pride they have as Canadians is our healthcare system. And I think probably that's an opinion that's shared with those of us who are together today on this call. But I know that many of us also feel that the system is very much under threat and has become increasingly fragile over the last few years. Many of us don't actually have access to primary care. We don't have doctors. Some of us end up in emergency rooms when we need to see somebody, or in private clinics. So the system is increasingly fragile, and that's one of the things I want to talk about. So, and I also wanted to mention that one of the things that I've done lately, and I'm very glad to see that you'll be talking with him, is worked with Charlie Angus. When the threats from the South started arriving across the border from the Trump administration, Charlie Angus and John Cartwright and Alex Himmelfarb, a number of us got together and we formed a group around something called the Pledge for Canada. And some of you were probably aware of it. It sort of peaked at about 75,000 signatories, and then we did a number of actions around the idea of pushing back against the threat from the Trump administration. And there was for a while a newsletter, etc. And one of the things that we focused on in that pushback against the attacks from the Trump administration was the defense of the healthcare system, because that is one of the things that clearly differentiates us from the United States. And we feel very strongly that that is something that we need to be propping up and supporting as a nation building project. So just to go back to the origins of the healthcare system in Canada, the first province to endorse healthcare was, many of you are probably familiar with this history, but I'm just going to mention it quickly, was the province of Saskatchewan, where Tommy Douglas was the premier. And after a lot of struggle in Saskatchewan, they took over the control of some of the hospitals, and then they introduced universal public health care in 1962. The doctors immediately went out on strike with the support of the Canadian Medical Association and the American Medical Association. This was viewed as some kind of communist plot to bring in universal public health care, even though it had been introduced in England immediately after the war by the Labour government in 1946. So healthcare has always been under siege, I guess we can say. There's always been opposition, open and not so open, sort of stealthy opposition. And yet, over the next several years, healthcare spread across Canada, first in Saskatchewan, then to New Brunswick under Louis Robichaud, and then after that, one province after another. So it was a gradual process of endorsement. And the last province to join public universal health care across the country was Quebec in 1970. And again, in 1970, the doctors in Quebec, the specialists in the case of Quebec, threatened to go out on strike, and they were prevented from doing so by the introduction of the War Measures Act. So, which is kind of ironic, because I guess you could call it labor action, was stopped by the War Measures Act. So the history of healthcare has been a bit of a bumpy one, and it continues to be so, because the forces arrayed against it are powerful and well-resourced. And that's what led to the founding of the Canadian Health Coalition. In 1979, Tommy Douglas, and with the support of Monique Bégin, who was a member of the then Liberal government, and a number of other leaders across the country in the labor movement primarily, and in the faith community, launched the Canadian Health Coalition, which is where I work now. And the idea of it, and we put it up on our webpage, I put the link to our webpage in the chat. There's a quote from Tommy Douglas who says, you know, the opposition to healthcare are many and constant, and we need to be continuously struggling to protect and advance healthcare, because there are very powerful forces arrayed against it which wish to push it back. And I think if you live in the provinces of Ontario, Alberta, and obviously Quebec, you'll know what I'm talking about, because the forces of privatization are very present and very insistent, very vocal. And so those are the three provinces that are sort of on the slow, steady decline into increased privatization. So our struggle is at the federal level with the Canadian Health Coalition, but also with the provincial and territorial health coalitions. And some of you may be aware of the activities of the Ontario Health Coalition, which is led by Natalie Mera, or the BC Health Coalition with Iandri Riddell and others. And in Alberta, very active and very credible health coalition called the Friends of Medicare, led by Chris Galloway. So we work on the federal level as a pan-Canadian coalition, but we also work with our allies at the level of the provincial and territorial health coalitions. So the Canadian Health Coalition is formed of frontline medical workers and their unions, and researchers, civil society groups, and faith-based groups. The Citizens for Public Justice are members of our board. The United Church has historically been a member of our board, as are the big unions, the Canadian Labour Congress, the Public Service Alliance of Canada, the nurses' unions across Canada in each of the provinces and territories, the Canadian Federation of Nurses Unions, etc. So we consider that we represent approximately 3 million people across the country, probably more. It's very hard to quantify when you're sort of trying to tabulate what a coalition represents. But we also consider that we represent the vast majority of Canadian public opinion. When Canadians are polled, you know, they overwhelmingly say that they support public universal health care, like 75% and up. But increasing numbers of those people who are polled will say that they think that the health system is in crisis. So we're at a critical moment, because I think what we're seeing is that the recent bad news from Alberta, the Danielle Smith government introduced something called Bill 11. They rammed it through using closure, or did they use the notwithstanding clause? I can't remember, but anyway, they pushed it through without any real debate. And what they've done now is they've created dual practice in Alberta, where the physicians can bill publicly and privately at the same time. So this is a new opening, like a new breach in the healthcare system. And we will be going to Parliament Hill, and that's where you might be able to help us out. If you go to our webpage, there's a number of actions, campaigns that we have put up on our webpage, asking people to sign on, send letters, sign our petitions, send letters to their MPs. But we've also organized a demonstration on February 10th at noon in Ottawa on Parliament Hill. And I put a little graphic poster to that effect in the chat. So if you're anywhere in the National Capital Region or in any position to come to Ottawa, we would really love it if you could join us on that Tuesday at noon, from noon till 1. And we were really hoping to make enough noise on the Hill to catch the attention of the Liberal government of Mark Carney. We are doing that in the context of a federal Hill lobby as well. We're sending up a number of supporters and defenders of public health to meet with members of Parliament and senators between the 9th and the 11th of February. So the demonstration is sort of like the high point of those 3 days that we intend to spend on the Hill. And we've recruited 200 public health care defenders and frontline healthcare workers from across the country, from every province and territory, to join a kind of a big contingent of people who really care strongly about public health care to go up and meet with senators and MPs and parliamentary staff to talk about the importance of healthcare across the country. And we are increasingly now putting pressure on the Carney government to use the Canada Health Act to try and stop these provinces from taking Canada Health transfer money and not putting it into healthcare, and then allowing private interests to delist services, to impose private diagnostics. In Ontario, we're seeing a big push by the Ford government, especially for those who want cataract surgery and other kinds of surgery, to basically be up-billed, forced to pay additional fees in order to get their surgeries because they're on huge long waiting lists. There's all kinds of scams being used by governments that are effectively against universal public health care and are, aligned with private interests, private insurance companies, and private clinicians. The worst province of all, arguably, is Quebec. We can talk a little bit about that later if you're interested. But the 3 provinces that are leading the sort of the sharp end of the attack against healthcare are Ontario, Alberta, and Quebec. So I just wanted to make that that point as right off the top. So but the problem partly is that we are at the federal level, and much of the money that goes to healthcare comes from the federal government. But the healthcare system, as you know, is administered provincially, just as education is. So there's this jurisdictional tension. But the federal government does have sway in the sense that they control billions of dollars of money that is transferred to the provinces for healthcare, roughly 50 billion a year in the form of the Canada Health Transfer, in addition to bilateral agreements that lead to transfers in money for example, an emergency fund for mental health to try and stem the mental health crisis across the country. Those bilateral agreements will probably not be renewed by the Carney government. We saw in their last budget that they didn't remove any of the Canada Health Transfer money, but they didn't increase it either. And there is no money in the budget, at least as far as we're aware, for those bilateral agreements for things like mental health. So the Carney government in that last budget, their first budget, because the Carney government, of course, was elected in April, they are imposing cutbacks to the federal public service, including significant cutbacks at Health Canada and things like food inspection, etc. So nothing with the word care in the Carney budget received any kind of priority. Health care, dental care, child care, those things do not interest this particular Liberal government. And what they did do is they quadrupled the military budget in that last budget, which we think goes against the interests of the Canadian people. And this is something we can talk about in the chat. So they quadrupled the military budget, and they froze effectively the kinds of expenditures that actually improve people's lives and health. So this is something that we're quite concerned about. This is not the government of Justin Trudeau. The current health minister, Marjorie Michel, the member of parliament for Papineau riding, which is a riding that I actually ran in for the NDP in 2015. This is one of the poorest ridings in Canada. She is the current member of parliament. She has refused to meet with the Canadian Health Coalition. So we have managed to book over 100 meetings with parliamentarians of various kinds during our Hill lobby between February 9th and 11th. But the health minister has refused to meet with us. So this is, we view this as part of a deliberate exclusion of all things social by the Carney government. And we figure that the minister doesn't want to meet with us because she doesn't want to be on the record on anything with regard to the Canada Health Transfer or the Canada Health Act, enforcing the 5 criteria of the Canada Health Act. And so I think we'll probably make a bit of a fuss about that when we go up on the Hill in a week and a half or so, because it's really, it is unacceptable for the health minister to not meet with us. That's number one. Number two, our allies at the Council of Canadians did some research not too long ago that showed that the insurance industry, which is registered as a lobby, various insurance companies that are registered with the Federal Lobby Registry, have met with the minister, the health minister, at least 29 times since the election last April, and a number of times with the Prime Minister's office as well. But the health minister will not meet with the Canadian Health Coalition. That in itself tells you what's happening on Parliament Hill right now. Now, obviously, they're under enormous pressure because of the chaos emanating from the United States. But when a country is under that kind of pressure, the country needs to be sure that it's shoring up its flank and protecting its people by maintaining the social safety net, something that has failed abysmally in the United States. So we're not too sure just how we're going to make our unhappiness known, but one of the things we want to do is have a very effective demonstration on the 10th at the noontime in front of the Hill. So I really, really hope that anybody who's in the National Capital Region on this call can come to the demonstration on the 10th, but also that the word could go out to the Unitarian community and all of its allied and friendly organizations to make sure that anybody in the Ottawa area joins us for that demonstration. Because I don't think I have to tell anybody on this call, public universal health care has saved lives, thousands, if not millions of lives across Canada. Prior to the introduction of healthcare in the 1960s in Canada, people paid out of their pockets to go to the hospital, and many people did not go because they didn't have the money. People have forgotten that in Canada. Before 1962, if you wanted to go to the hospital to have chest pain addressed, or you were going to deliver a baby, or you had pain in your side because you had appendicitis, if you couldn't afford to go, you weren't going. And in my own family, in my dad's family, one of his uncles died of a ruptured appendix in and around Toronto and near the Holland Marsh, because one day he came home and said, I have a terrible pain in my side. And they said, well, why don't you go to bed and see how you feel in the morning? Well, by morning he was septic, and by that evening he was dead. And that was in the 1950s. So that's not so very long ago. People have forgotten what that was like in Canada. It's many generations ago. Younger people have no recollection of it. And many of us who are older even don't have any personal connection to it. But when my grandmother died, she left papers which I inherited from an aunt of mine, and I have bills that the family paid to St. Joseph's Hospital in Toronto for when she developed heart disease, and by the time she was adequately treated, it was too late. This is in 1955. So, and if you dig around, I'm sure you could find those paper trails in many of our families' papers. So this is a very important struggle, I don't need to tell you. We are all trying to now be more creative, be more militant, be more pushy about trying to defend universal public health care. And so that's what I wanted to present to you. And I was hoping we could have a discussion about what you think, or what you're seeing, or what you would suggest, or how we can all work together. Because right across all of the civil society groups that many of us belong to, the political parties that we may belong to, we're going to have to close ranks and really fight for this, because this current government is extremely interested in opening Canada up for business, but is not particularly interested in making sure that we all count and that we all get the care and the support that we need. So we didn't get healthcare by being nice and polite about it. Women didn't get the right to vote by being nice and polite about it. We got these things because we struggled for them. And we have perhaps become a little bit blasé, and also tired. I mean, everything is very hard. These are difficult days that we're living in. But this is a very important struggle. Like, if you cannot get proper health care, then you can't really function, right? Many of us are blessed with good health, and some of us not so much. And also, we just need that safety net, which is why the logo of the Canadian Health Coalition is an umbrella for protection in difficult times. So I guess that's really all I wanted to say. And then I guess we could just discuss, like, I don't know if you want to manage the questions, Ellen, or should we just do it by raised hands? Or
Yeah, the raised hands will help. There's also already a question in the chat, I think, by Omar. And maybe you can have a look at that.
There's a question in the chat. Maybe I'll just start with that question from Omar.
Yes.
Omar has asked in the chat, how are we involving healthcare unions and unions in general? Well, this is a very good question, and a big part of the reason why we even have healthcare is because the labor movement after the war, along with the co-ops and the faith-based groups, notably the United Church of Canada and others, got together and pushed for it in the province of Saskatchewan. Tommy Douglas, or T.C. Douglas as he was known, was a Baptist minister, and a proponent of what they called the social gospel. The idea that we should be trying to build a heaven on earth. We should not be waiting until the next life. We should try and improve conditions for those of us here now. And so in that sense, that the push, the campaign for healthcare was heavily colored by that desire for social justice and by the labor movement. The labor movement knew that its members needed healthcare. And so they organized accordingly, and they funded and pushed for healthcare, specifically in Saskatchewan to start, and then in all of the other provinces afterwards. So in that sense, Canada was able to define itself very differently from the United States and more in alignment with countries in Europe, Northern Europe, specifically the Scandinavian countries, and with England, with Great Britain, where healthcare was introduced by Anayan Bevan. I don't know if you're familiar with this name, but if you have nothing to do one day, you should go on Google and look him up. This guy was an incredible tribune, a great speaker, and an incredibly articulate proponent of healthcare, universal public healthcare, for working class people, for people on low incomes, for older people. Like, he gave these incredibly beautiful speeches about the importance of healthcare in the post-war period. And I remember my own father, who was a veteran of the Air Force, Canadian Air Force, saying, you know, a lot of guys came back from the war and they said, you know, we watched how much money we had to destroy the war and kill millions of people. There's clearly money available. So let us now use those resources to rebuild and provide care and services for people in the aftermath of that disastrous conflagration, which killed so very many people and ruined huge sections of the world, smashed cities all over Europe. Now let us build something. And that led to the post-war boom of which healthcare was a part. So the labor movement is currently very active in supporting the campaigns to protect public healthcare across the country. Our coalition has on its board representatives of the Canadian Labour Congress, the Public Service Alliance of Canada, the Canadian Union of Public Employees, the Service Employees International Union, all of the nurses' unions, the Ontario Nurses Association, the Alberta Nurses Unions, and the Canadian Federation of Nurses Unions. We have friendly relations with the unions that represent technicians and perfusionists and respiratory technologists in the public system, with teachers. So, you know, labor was what fought for maternity leave. The labor movement has fought for daycare, for equal pay for work of equal value, and it has fought for decades, if not centuries, for universal public health care and healthcare. So we work very closely with the labor movement, and we have very vocal members of the labor movement on our board, and we listen very carefully to what they say, and they fund our work quite generously, I would say. I personally am a member of a union. I work for an organization that is largely funded by unions, and I am a unionized employee of the Canadian Health Coalition. I belong to Unifor, and my father belonged to the precursor of Unifor, which was called the Canadian Auto Workers. So labor is front and center, as it has always been, in terms of advancing these kinds of causes for the betterment of the working people. And in fact, I have in my house a poster by Walter Crane, one of the artists of the English labor movement, and it says, "The cause of labor is the hope of the world." And I think that's still true. So I hope that answers your question, Omar. I don't know, should we go to the chat, Ellen, or should we go to the hands up?
Angelique has her hand up for a
Okay,
while.
sorry, go ahead. So go ahead.
Just keep it brief, Angelique, just
Yes,
like
well, and thank you so very much. Your contribution has been absolutely wonderful and very informative. And I do agree with you that I think the labor movement and the importance of organization, labor organization in general, is so important towards these causes, including the history that we have with the universal health care here in Canada. What I wanted to ask you is this. When the coalition, I understand, is focused on the Canadian front, has the coalition looked into, and is there any type of organization or movement in advocating for universal health care universally across the world? I mean, this is a serious issue that there obviously is no protection. I mean, we're fortunate in Canada that we had the labor movement behind us that, promoted this. So I'd like to hear from you on that. I'd like you to, when you have a moment, to write in the chat the name of the gentleman that you mentioned from the UK. I'd like to check that out further. And yes, and also I just wanted to mention that I urge you to contact me and to let us know, our organization, in terms of what your organization is doing, because we would be happy to promote and actually even publish. We do a lot of social media. We have the websites. We can publish the events and, things that you're organizing, like the protests and that, so we can give it some more visibility online. So anything that you have in that respect. But thank you very much. So if you think you can answer any of that, that'd be great.
You're more than welcome. So we primarily focus on Canada, but through some of our allies, we're in touch with what is being done in various countries in Europe where similar problems are arising. I mean, the insurance, arguably big insurance and big pharma are some of the most powerful corporations, in addition to oil and gas, like the fossil fuel industry. These are very powerful vested interests. So some of these same problems are rearing their head in other jurisdictions. But we, the Canadian Health Coalition, do not have direct international ties with similar bodies, but we recently received a delegation from Malaysia that wanted to see how our healthcare system was organized. And some of the organizations on our board are aligned with international development. For example, Inter Pares has a representative on our board. So Inter Pares keeps us informed of the work they're doing in places like Sudan and Indonesia and countries that are struggling to address some of these issues. And so we do try and keep the door open to that. And we are in touch with various allies. And if anybody ever wants to contact us, we would never turn them away, or we would try and be as helpful as possible. But our focus is largely on Canada. It's such a far-flung, complicated country in some ways, difficult to build movements across such a wide, such a huge geography and so many varied jurisdictions. And because healthcare is partly federal, partly provincial, and also sometimes partly municipal, it gets quite complicated, which is sort of the story of the country known as Canada. But I would love to stay in touch, actually. Thank you very much for that, Angelique. Maybe I will make sure that I get your information and coordinates. The person I was referring to, the health minister in England, who was such a great tribune for healthcare, was his nickname was Nye Bevan. He was from Wales, and he had the most beautiful way of speaking. And I really, it's very inspiring to see him. And the famous Welsh actor, Michael, I'm going to forget his name. Anyway, there's a very wonderful British, Welsh actor who's in the series called Good Omens.
Oh,
Michael,
yeah.
what's his last name? It's not coming to me. Anyway, he does an interpretation of Nye Bevan's speeches. He performs them live, which is also on YouTube. And it is really just absolutely wonderful and very inspiring if one day you're lacking inspiration to watch Michael, whose name I cannot remember, deliver these speeches, perform them as an actor, but also as a humanitarian himself. He has changed his corporate entity as a famous and successful actor into kind of a nonprofit, and he gives away most of his salary to social movements in the UK. Bugger, I can't remember his name. Isn't that embarrassing? It'll come to me when somebody asks another question.
Don't find it right now.
They're terrible. Anyway, okay, so thank you for those questions, Angelique and Omar. And the name of the minister again is Nye Bevan, or Anurin Bevan. I'm not sure how you pronounce it properly in Welsh. So should we go to Gary?
Yes.
Ellen? Is that okay?
Yeah, I think the other things in the chats for now are more remarks than questions, but yeah.
Michael Sheen
Aha.
is the actor. Sheen, Michael Sheen.
Very good.
Okay, sorry. Go ahead, Gary.
Okay, I'm wondering if you can just talk about the ways that our governments, like Ontario and possibly and Quebec, I guess, and definitely Alberta, are making things so difficult for a smooth process in the health system that they keep on pushing this privacy, bringing in the private actors. I'll give them as an example. I just had a hip replaced. I was identified in April of last year that my hip was bone on bone, which means you really need to have something done about it then. That I had a lot of pain before that, obviously. It was a couple of months before I got to see a physiotherapist who would say, I really need one. And I did get, and as soon as he saw my thing a couple of months later, he said, yes, I'm recommending that you do. And then it took another 2 to 4 months to get to see a surgeon, and then a couple of months to get the actual operation. Like, I think everybody gets done, but why the long waits between each step? To me, sounds like it seems like it's just put out
4 years ago
without
easier and more effective.
like, we can build cars on our system of just-in-time delivery, and yet to do something in the medical system, it is extremely time-consuming. So, that's one example, I think, of what's happening.
Mhm.
Make sure that we can bring in more private sector. Are there others that we should be aware of?
Well, in answer to your question, I mean, the activists in Alberta and in Ontario tell us this is a deliberate strategy by the friends of the private sector in the governments of Alberta and Ontario. They are deliberately under-resourcing the systems, and in the case of Alberta and Quebec, they're allowing more and more procedures to be done in the private sector. So there's a finite number of practitioners. So if you're allowing people to go off into the private sector or operate in private clinics, those people are not available to do the interventions in the public sector. So the wait times become longer and longer and longer. So in fact, privatization doesn't solve the problems of the wait times, it just aggravates them. And yet, the continuous discourse we're hearing from certain people is that we should be going to a private system. So it doesn't make any sense, and yet that people are desperate, so they think, well, maybe it would be better if we did go to the private system, and if I don't have to pay with my credit card, and those private clinics are billing the public sector, then that's better than nothing, or that's better than not seeming to be doing anything. So there is a deliberate sort of doublespeak about privatizing, and there are a lot of very powerful interests that want to get their claws into our healthcare system. It's a hugely profitable industry in the United States and elsewhere. And so I think the partial answer to your question, Gary, is that the argument that private services is better and faster is very compelling on the face of it. The fact of the matter is it prolongs the waits in the public. It's a bit like the analogy is in the education sector. If you have public schools and private schools operating at the same time, the private schools will be often filled with kids from better resourced families where there's books in the home and there's better access to ideas and information and a higher level of education. So the kids in the private schools tend to do better scholastically. And the kids in the public sector, where there isn't perhaps as much there aren't as many resources available, where the families are not perhaps as well off, and the kids have more needs, special needs that need to be addressed, those kids seem to be dragging. But the problem is that the resources are being funneled off to the people who already have resources. And that's exactly what's happening in the healthcare system. The private clinics and the private services are being used by people who are generally in better health because they have more income. And so they're easier to deal with. And the physicians on the private side are happier and have better working conditions, as do many of the nurses. And in the public sector, the heavier pathologies, the more complicated cases are being addressed But the pool of people who do the care, who do the surgeries, and who are the nurses and the technicians, there's not an infinite number of those people, right? So it's a kind of a confidence game or something. It's like we're being tricked into thinking that private care is better. It is not better. It's good, I guess, but it's being done at the price of the care in the public sector. So that's why you waited a long time, Gary, because some people could afford to go to clinics where they're upbilled and they're paying additional fees and they're getting seen sooner. And the doctors who are doing those surgeries are not available in the ORs in the public sector. So that's why people wait a year, 2 years, 2.5 years. Many people in terrible pain. This is not acceptable. And it is arguably a violation of the Canada Health Act. And the federal government doesn't want to go after the provinces that are doing this stuff for reasons that we do not quite understand. At one time when Jane Philpott was the federal health minister, she withheld a substantial amount of money from Quebec, where Quebec was allowing doctors to extra bill. Dermatologists were charging $30-40 for surgeries to remove precancerous tissues and stuff like that. And enough complaints were made that finally the health minister said, okay, we're not going to give you the money until you stop doing that. And Quebec stopped doing it because they withheld, I don't know how much money, hundreds of millions of dollars to Quebec. So that's what has to happen. The feds have to withhold the money to put pressure on these provinces. And they're not doing it. And I suspect that some elements inside the current federal government are just as happy to see the private sector take on a bigger and bigger role in places like Alberta and Ontario. I suspect that there are people in the current Liberal government, which is now kind of dominated by Goldman Sachs, right? The Prime Minister himself was a Goldman Sachs guy. The Natural Resources Minister, Tim Hodgson, is a colleague of Mark Carney's from the days of Goldman Sachs. And there's a key advisor in the Prime Minister's office, I forget his name, also Goldman Sachs. Like these are hedge fund banker type guys who think capitalism is going to solve all our problems. So they're not really keen on interfering with this privatization that's happening most aggressively in Ontario, where they're now moving to privatize hospitals. And I would refer you actually to the Ontario Health Coalition, Gary. Like this is a very well organized network of local branches. There's quite an active one, I think, or an increasingly active one in Ottawa. And the person who runs the Ontario Health Coalition is Natalie Mara, and she's very good on this privatization stuff. Like she gathered 50 names of people who have been extra billed for cataract surgery, and they went public to denounce the Ontario government on how people whose vision is impaired, who are desperate for cataract surgery, are being told, well, if you give us another $5,000, we can move you up on the queue. This kind of stuff is going on, right? So they've gone public to denounce this, and they're putting pressure on the Ontario government and on the federal government to stop this. And they're embarrassing the Ford government by going public with this stuff. So this is the kind of thing we have to be doing, is we have to be naming and shaming this kind of behavior. Anyway, sorry, that's a long-winded about answer.
No, that's excellent. Thank you.
Yeah.
Thank you for explaining that, because I have a friend who says, oh, this healthcare is terrible. I'm going private. And I'm sort of like, no, don't do that. But yeah, it is a nasty result that is happening. And who is really behind that? Do they have their hands into government and so forth? It must be that people that are involved in the legislation and so forth are tied to some of these people that want to promote the privatization. How can we find out? And
well, it's very, they don't really try to hide it, particularly like we saw it with long-term care in Ontario. The privatization of long-term care for people with mobility issues and that kind of thing. And we saw the consequences of that during the pandemic with the numbers of people who died in these privately owned long-term care facilities owned by Revera and other names that I cannot remember.
yeah, one is across the roads from us.
The
Yeah.
care was not up to standard. And then when the pandemic hit, the staff was overwhelmed. Many staff members got sick and people were abandoned. And in the case of Quebec, in the long-term, the privatized long-term care facilities here, they brought in the army. There was a particular residence called the Heron Residence in the West Island of Montreal. The staff just basically abandoned ship, and a number of people were found dead in their beds in that particular care facility when the military came in. There was nobody was there to protect the patients.
Yeah. it's
I mean,
horrible.
so, and it's clear that the for-profit institutions, when the pressure is on, the care is inferior. The outcomes are less positive than when things are publicly administered. So now I'm not saying public administration is perfect, but there are standards and regulations which are more rigorously applied in the public sector. When you privatize, you lose control. And you lose information, key information about what's happening in these kinds of institutions. I'm thinking of long-term care, but the same thing could be said about private clinics, private hospitals. And if you have a surgery in a private clinic, as you can in Quebec, like I'm speaking to you from Montreal, you go to a private clinic to have surgery on your sinuses or something. If something goes wrong, you are transported to the public system for emergency care.
Yeah, that is
And the
ironic.
consequences of the privatization are being paid for in the public sector. Problems with the private sector. So it's ridiculously short-sighted, shall we say, to proceed down this privatization road in this way. It puts people at risk, serious risk.
Definitely.
Anyway, I don't know if there's any. Wait, okay, so I'm just going to go back to the chat here.
Yeah, the Penny Clipperton has something there.
Well, there's something here that's from somebody named Kay, I believe, who's saying it would be useful to ask MPs and MPPs to declare whether they or their extended families gain income from private healthcare. This is a very good point. One approach might be to seek an expanded definition of conflict of interest regulations and ethics. Well, absolutely. Really, absolutely. I couldn't agree more. And I suspect that that's I mean, when you say that the federal health minister has met with big insurance and that it appears on the lobby registry 29 times, then there's clearly something funny going on. And there are lobby registries at the provincial level that show similar numbers, right? People who are meeting with various representatives of the private system, and it appears on the registries, the lobby registries. And, a number of those meetings don't appear on the registries because they're not happening on Parliament Hill, presumably, right? The registry only records, I believe, meetings that occur on the Hill or at the constituency office of the elected person. Who knows who they're having lunch with or, playing golf with, kind of thing. These are powerful, well-resourced corporations. Big insurance and big pharma especially have very deep pockets.
Yeah, very much so.
And that is why one of the campaigns we were very active on in conjunction with the New Democratic Party was pharmacare. Canada is the only healthcare country. There are about 29 or 30 countries that you could call healthcare countries that have some form of universal healthcare. We are the only ones who do not cover drugs, medication, because the lobby is so powerful that when they brought in healthcare, the people who brought it in thought, look, we cannot fight on all fronts. We're just going to go ahead and introduce hospital care and primary care coverage, and we'll try and get to pharmacare later, and dental care. Those two things were left off the agenda. So we were able to get the pharmacare law passed under the Trudeau government under the cooperation and supply agreement that was signed between the Liberals and the NDP. But it's only been advanced in 4 jurisdictions, 3 provinces and 1 territory, and only for 2 streams of medication, for diabetes and for reproductive medications and devices. And it's frozen there. This government, the federal government, doesn't want to push it forward. And so people are trying to push their provinces to advance it, but with varying degrees of success. I mean, I think probably New Brunswick would sign an agreement with the federal government in short order, at least on those 2 streams of medications. And there are other provinces and territories that are interested in it, but the federal government doesn't really even want to talk about it. So it's stopped. Even though they passed a federal law they're not pushing ahead on their own law. That's on pharmacare. And on dental care, we weren't able to get anything better than what we have now, which is a means-tested program that is being managed by Sun Life with our tax dollars. It costs us $1 billion a year to Sun Life to run the dental care program. And by the way, if you haven't applied for it, you really must apply for it. Everybody whose family income is less than 90 grand is eligible for help with their dental care. Now, you know, some stuff is not covered, but cleanings and, you know, ongoing maintenance is covered. I would really, really encourage you to apply. You just put in the search bar Canada Dental Plan, and it comes up, and all you need to do is put in your SIN number, and you are instantly processed. And some of you who haven't applied will be pleasantly surprised to find out that you're eligible for dental coverage.
Really makes a difference. Yeah.
Yeah, we fought really hard for that, and this is the best we could do. It's far from ideal, but it is better than nothing. And approximately 5 million people are eligible and are getting some form of dental care now that weren't getting any dental care before.
Yeah, and it's so important because it's connected to everything, you know, your digestive system and sport and nutrients and sport.
Yeah,
Uh,
and you
that
know,
is
the dentist was telling me the plaque in your mouth is similar to the plaque in your arteries. You need to keep your mouth reasonably well maintained and reduce debris in your mouth in order to maintain overall health. It's basic health care. Dental care is part of the National Health Service in the UK, but it is not covered here,
No.
or at least not fully covered here. And so we fought pretty hard for those two things under that cooperation and supply agreement. And we were able to make some progress on those two programs. Meanwhile, we're losing the battle behind the scenes with regard to privatization and private clinic services and, you know, ripping people off who need cataract surgery and telling people, well, you know, I actually sat in a doctor's office and was told, well, you could wait 6 months to get into the hospital for treatment, or you could just go to my privately owned clinic for care. And I said to this doctor, I think that that is a conflict of interest, and you probably shouldn't be saying that to us in this meeting.
Yeah.
He looked embarrassed and he stopped. And as a result of that, my then husband got into the public sector, I think, a little bit more quickly, because I think that scared that person. But some doctors really are in it for the money. And I mean, the vast majority are not, but some really are. And I had a really interesting exchange with Jane Philpott, again, who is a physician and was the first ever doctor to be named Minister of Health. And she wrote a book about her ideas about community healthcare, and she's now working for the Ford government in some capacity, which I can't quite grasp. But anyway, she said to me, she said in an interview, it took her years of working in the medical system to realize that some doctors are actually not in it to help people, they're in it for the money. She said she found that really shocking. And I was interviewing her in front of a room full of healthcare advocates, and they all started laughing when she said that. Because we know that some doctors really are, first and foremost, they're business people. They want to be independent operators and they want to make money. Not all, not anything close to the majority, but there are doctors who operate in that mindset.
There's enough of them.
Yeah.
Anyway, thank you. And Frances has her hand up.
Yeah, go ahead, Frances.
Yeah, I was just saying, you're talking about 3 provinces, but you haven't mentioned BC. We have this problem in BC. There's no question about it. My friend was directly offered the choice between waiting to have her knee done for a year or having it done in 2 weeks,
Right.
and paying for it.
Right.
And I was really shocked when I realized today, I thought, cataract surgery should be covered by Medicare. Why are we paying for it? And just before I came on this, my husband just had a cataract operation yesterday. And he had to pay for the prep, and then he had to pay for the operation, and I think he's going to have to pay for the follow-up
Wow.
because he's on the private system. And his ophthalmologist, I don't believe, informed him that he had a choice to get it through the public system if he would wait,
Right.
because he did not recommend him to wait. He'd already waited for a couple of years getting treatment, getting ready for the cataract surgery.
Yeah. Well, so in that case, I agree with you. And we don't think of BC as being as far gone as Ontario, Quebec, and Alberta, where we have arguably conservative and even right, more right wing than conservative governments in place, right? Like what the government of the Ford government is not too clear, but it's something to the right of conservative, I think. And same in Quebec, we have the Coalition Avenir du Québec, which doesn't sound like it should be conservative, but it is a very conservative government, very intent on privatizing. And Alberta is openly libertarian, right-wing conservatives. So you're right, it's important to think about BC, because even though they have an NDP government in place, they don't seem to be as interested in rolling back some of these kinds of scenarios that you just described. And I just put in the chat the criteria of the Canada Health Act. There's 5 criteria in that act that was passed in 1984 unanimously in the House of Commons, spearheaded by Monique Bégin, who came to Canada in the aftermath of the Second World War as a refugee and whose family really suffered from lack of health care when they landed in Montreal. She grew up in NDG, Monique Bégin, and she saw what it meant not to be able to get health care after the war. So she was very keen on passing this bill, and she managed to get it through. So the 5 criteria of the Canada Health Act are public administration, comprehensiveness, universality, portability, and accessibility. And it specifically says Canadians should receive medically necessary hospital and physician services through publicly funded, accessible, and equitable systems. So what you just described about kind of getting scammed or not being fully informed, those are clearly violations of the Canada Health Act. And anybody who is getting jerked around like this should file a complaint, send a letter of complaint to the health minister of their respective province or territory. And they should send it also to Health Canada, because there is a department at Health Canada that whose job it is to investigate problems with the maintenance and protection of the Canada Health Act. There is a Canada Health Act department at Health Canada that investigates violations of these criteria that I just put into the chat. And if you complain, they are obligated to look into it. Now, what happens after they look into it is, not known, not necessarily where we would want it to go, but it goes on the record and they have to investigate it. The other thing you can do is complain to the professional bodies. In the case of the cataract surgeries, the physicians who do those surgeries are overseen by a professional body. And if you file a complaint to those people, that can also have a positive effect. Because
everybody's so worried about their relationship with their ophthalmologist. Their eyes are so precious to them.
Yeah, no, I know. And that's
I don't think I could ever persuade Ron to make a complaint about his ophthalmologist.
Well, that's the problem. In a nutshell, at least a part of the problem for sure, is that people are dependent on their healthcare providers and they don't want to make life difficult or be the squeaky wheel or the whistleblower. And that's where your health coalition comes in. Like there is a very active BC Health Coalition. That would be something to take to the BC Health Coalition and say, look, this is what happened to us. What do you think we should do? And then try and get together with others who have similar complaints. Because you are not alone. There are hundreds and thousands of us who banged up against this. And each of us has to do the right thing insofar as we have the energy and the capacity to do it.
It was a whispered discussion in the waiting room as I was waiting to pick Ron up.
Yeah, well.
So
what happened to me, it wasn't whispered, it was openly said across a desk. Like this has become more and more in your face. And so there has to be pushback. Now, I'm not suggesting that each of us has to do that alone. Like I would suggest that you contact your provincial or territorial health coalition. In BC, there's a very active one. In Ontario, also very active. In Quebec, not very active, but still there is a coalition. And there are patients' rights groups. Unfortunately, some of the patients' groups are funded by pharma and not necessarily always as effective as a result. But the best thing you can do is to try and find, others who are in similar straits and see if you can't work together. It's very difficult. This is a difficult period in terms of activism, but there are existing groups, and if push comes to shove, you should try and contact us at the Canadian Health Coalition. We'll try and find some kind of connection for you to help try and stop this, because we're going to have to get creative and a lot pushier. And I'm going to go back to the subject of this demo that we've organized on the 10th on the Hill. Like, we really hope a lot of people can show up and make a lot of noise, and we can maybe embarrass the federal health minister who doesn't want to talk to us about this, but they'll
crazy.
talk to insurance. It's like, it's the world upside down. Like, why are you talking to the people who want to make money off of the suffering of Canadians?
By the way, Anne, there was a question in the chat that said, is there a Zoom online or so to join?
Oh, I don't think we have because it's outside.
Yeah.
We don't really have a plan for a Zoom participation. I don't even know how we would do that. Have a
On somebody's,
stage and-
on somebody's phone, you could do it actually to stream, but
Oh, I
anyway.
see what you mean. Well, maybe we
Yeah.
should try and do that maybe on Facebook.
Yeah, it
or
would be interesting, and probably some savvy people in your community that can do that.
Not
Anyway.
me, not so much me, but yeah, that's a good point. I'll mention it to the colleagues. Maybe somebody can take that on as a Facebook Live or something.
Yeah,
Yeah.
and I see that Angelique has her hand up.
Thank you. I'm going to be very brief, but I wanted to ask you, Anne, if you know anything about this practice with the Ministry of Transportation here in Ontario. I have a friend who he's in his 80s, and he was his doctor passed away. He went to this new physician who sent him to do all these tests, blood, heart, and sent him to this geriatric doctor who gave him this, what is called a MOCA test. It's like on a sheet, they ask him some questions. The man doesn't speak English well, and as well has a hearing problem. So she gave him apparently the wrong test, but what happened is she made a report to the Ministry of Transportation saying that he should be, because he didn't like he was below the passing mark on that test, that form, told the ministry that he should be doing this test. He should be tested for driving, although he had passed the driving test. When he went twice after the age of 80, they get tested every year, every second year, and he passed both of those tests when he went, but because of that report, he was suspended. So once you get suspended, you've got the right to go for a functional driving test, which is with an occupational therapist and a driving test. They charge the person $850 to do that. Now, I know that there, in some cases, people were not able to pay and they couldn't take the functional test because they just couldn't pay. I did some research for him. And my question is if this would be contrary in violation of the Canada Health Act.
I don't think that's Canada Health Act territory. Like, that's not, I don't think it's directly related to the Canada Health Act, but it sounds like a scam to me, for sure. And
They've got all these, yeah, they've got all of these centers all across Canada in the cities to give these functional tests, and people have to pay about $750 to $850 per test. It's called the functional driving test, and it involves a medical assessment of vision, movement, and cognitive, and then with the occupational therapist, and then there's a driver instructor. They go on a driving test, and the occupational therapist is inside the driving test. Now that's medical. My question is, how is that required that the person have to pay for that? Now, because he had insurance, he was with Chrysler and he was unionized. So his insurance paid. So the insurance, so, unionized workers, obviously, they have coverage, additional insurance to the health plan, provincial health plan, which facilitates, but for the workers who have not been in a unionized context, they don't have that privilege. So they have to pay privately. I mean, they have to pay out of their pockets. So, and I wanted to ask you on that front, how can we do something in the labor movement? I mean, obviously, the unionized workers have an advantage. Like I know that he's with Green Shield, which is one of the top insurance companies, health insurance coverage companies, and the benefits are unbelievable. And even just for dental, he gets like 6,000 a year coverage. There's a whole bunch of coverage, and that's additional to the health coverage. So my question is, the fact that we have this dichotomy here between unionized workers having these additional benefits because they obviously contribute through their union fees, I guess, during their work history, but the ones that have not had that privilege of being in a unionized, working environment are not able to have the same coverage, and therefore, there's this discrepancy. Can you address that perhaps and say what can be done on that level? Because we want to have, universal care applicable at the same level for everyone, not by having additional privatized, benefits or union, through these private insurances, right? That give extra benefits.
Well, with regard to the driver's license, I think you mentioned the Ministry of Transport. I think a complaint needs to be lodged with the Ministry of Transport, and then I guess the provincial health coalitions have to pick this up, because I'm afraid I don't really know the answer to your question, but I think there are probably people, activists in the provinces who have given this matter some thought, because it does seem like a cash grab at the very least. But I don't really know the answer. If your friend is in Ontario, I would suggest they get a hold of the Ontario Health Coalition. I just put the link in the chat for the Ontario Health Coalition. And I know that there are various chapters, specifically the Toronto chapter, very active, lots of union retirees. There are various bodies that represent union retirees that might have looked at this as a policy issue, because it does seem like there's a real problem with fairness at the very least. And there's probably consumer groups as well, right? Like in Quebec, we have l'Union des consommateurs and Protégez-vous, and there are various other organizations of that kind that have probably looked at this. In addition to the lobby groups for retirees in general, right? Like the sort of gray power groups, if I can use that term, and the names of which escape me, but there must be people who have looked at this, because what you've described sounds very unfair. So I'm sorry I can't answer with any more detail than that.
Anyway, we are basically getting to the end. There is maybe room for one more question, and then we have to wind it all up. Anybody else? And by the way, Anne, your video has gone really blurry.
I know, I don't know why. I think it's my camera.
Maybe you have to come closer to the camera or so. Is that maybe possible?
Yeah, I'll just adjust it in a sec.
No? Okay, well, what can you do?
Yeah, I'm sorry about that. My system is getting old, I think. Somebody asked what percentage of Canadian GDP goes to healthcare, and
Yes.
the projection is about 12% apparently.
Oh, really?
But there's debates about how these numbers are calculated.
Yeah.
I'm not sure that it's that high. Anyway, and what the Carney government just did was it froze healthcare allocations, and it increased military allocations to 5% of GDP over the next 3 years. So yeah, so there's some interesting policy changes in the works with the Carney government. We'll have to watch to see how that goes.
Oh, thank you so much. It was very informative and useful. And maybe I wasn't even aware of that there was an Ontario Health Coalition, so that's good to know. because I'm a Kitchener, and yeah, it is a bit scary that they want to privatize a lot of things, and no, it's no good.
No, I
So-
can't seem to fix it. I'm sorry about the picture. I would just say though, it's not just scary, it is part of the kind of backlash, neoliberal backlash against public programs. And we are all going to have to try and do as much as we can to stem that or fight it as best we can by filing complaints, by joining organizations, by attending this kind of webinar or gathering, and by joining forces with others through these provincial and territorial health coalitions, and also just hop on our webpage and you know, join with us too, because we try and keep people informed, and we work very closely with the provincial and territorial
And
health
you have a
coalitions.
YouTube channel, which I will put in the
Yeah,
newsletter.
we do a number of webinars which we then put up on our YouTube
Yeah,
channel to try and
just
inform
like we
people.
do.
So
Yeah,
yeah,
that's great. Anyway, well, that is really, thank you so much. And we are going now to do our traditional chalice lighting. Let me see here. Here's the extinguishing chalice, very simple. Maybe be the keepers of this flame of justice for all, and continue doing that, to speak up and fight for justice. Some resources here. We have the Canadian Health Coalition. This is healthcoalition.ca that you can go to. And then our Canadian Unitarians for Social Justice. The website is CUSJ.org. It's a big website. I'm the webmaster, and I have very little time, and I could use help with that. And keep up to date and subscribe to Just News Express, which is free, and it's again on our website with /Just News that you can sign on to. If you are not already, you probably are. There's a discussion forum, which is the CUSJ forum that you can join on Google Groups. And any remarks, you can email us at cusjmedia@gmail.com. We have a YouTube channel, which is at CUSJ Media on YouTube. And we have a Facebook group, also CUSJ-CA. So the next meetings are first February 21st on a Saturday at 1 p.m. Eastern, and about workers' rights and the disappearing workmen's compensation. Title is Who Killed Sir William, who was behind the workmen's compensation. And then Charlie Angus is speaking on March 28th. So just see Just News. We will keep you updated. And thank you so much, and work for justice and compassion, and do stay safe, especially with this winter. I have several friends who fell on the slippery pavement and broke shoulders and legs and toes and whatnot. So be careful. Anyway, we will talk to you again in the next meeting. And thank you again, Anne, and thank you all for participating and your questions. It was really good. So I'm ending the meeting now. Bye now.